everyone. So you might have heard that the NHS at the moment is in breaking point. Staff shortages, accident and emergency or emergency department keeps exceeding their waiting times. So amongst all of this background of trouble, what's it like actually working in the emergency department? These are common feelings that staff have, as well as the benefits of saving lives, etc. They're often feeling depressed, fatigue, stress, burnout. It's not particularly great feeling in terms of their own well-being. But they're also very comical as well and good-humoured, because this was within their staff room as well. So they take it light-hearted. But there is an important effect on their well-being, both on themselves and to patients. So for themselves, there's high job dissatisfaction, the staff shortages, high absenteeism, high staff turnover, so they have to keep retraining new staff, so you've got this greater cost again to the NHS. And for the patients, this also has a knock-on effect in terms of their medication, potentially poor prescriptions, over a use of drugs, less contact time with staff. So what are the stresses that exist? I know we're here talking about the environment, but of course there is this wider issues going on. For example, resource problems, management structure, dealing with potentially aggressive patients because of how they're feeling. But the physical environment is there. It is an important stressor. This is what staff in emergency departments have said. They've actually called it their 5th biggest working problem. And staff in one department in particular, in one study, found that 46% of them agreed that it is indeed a problem for them. And this is exemplified even more if they're already feeling stressed, if they've got minor psychiatric disorders, maybe general affective disease, they're already feeling they're already feeling burnt out. They'll notice the physical environment as even more stressful. So we did some research in one UK hospital. So there are limitations in the fact this is just one example. And our question actually wasn't around sensory problems. It was just what are the emergency department physical environment stresses, so in general. But I'll pull out the sensory ones today. And also is looking at are there restorative opportunities? So they've been working on tasks a long time, feeling fatigued. Do they have that chance to go and recover, have the break they need so they can go back and perform at the same level? And to do this, we took a number of approaches. I'm just going to go through 2 of them today, postcards and what we called stress walk interviews, so walking around the department, pointing out things that were problematic for them. This is an example of the postcards. We tried to make it as simple as possible, something quick and easy they could fill out while they were on what they called the shop floor. So they would have to describe what the problem was, how it made them feel, how they coped with it, and when it occurred. And from this, we got about 60 cards there's about 311 staff members in there. As you can see, a wide variety of the different staff members actually participated. But although we were asking about environment stresses, again, this other issues also appeared. The fact that they were being re-interviewed for their jobs, so there was low staff morale as well. So I just want to couch it all in the background of other problems that they had going on. But environment stresses did come up. And I could theme them into issues in terms of how they felt they weren't being considered. Their own staff well-being wasn't being considered. There was high dehydration. There were no water facilities on the shop floor, yet it was extremely hot, especially in resuscitation. They complained there was no quiet time. Then there were some other issues as well. But again, they were also really concerned about the patients. There was the privacy issues, both visually and acoustically, not being able to examine their patients in the way they would want to, or not be able to have all the communication that they would need because other people overhear him. And again, some other issues, not necessarily sensory, but affecting their experience at work. And the same issues appeared within the stress walk interviews. So around noise, a tannoy was a particular issue. So is there any way of communicating to other members of staff, trying to get hold of them? You'd have this loud tannoy go off. So what would be the solutions around that? Could it be done in a certain way so that it was clear, could still be heard, but not be at the loud levels it was being played at? Similarly, there were other communication difficulties, particularly in the handover. So between one shift and the next shift coming in, a sister would tell all the problems, all the issues with each of the patients, pass on the information. But they were having trouble overhearing, all the other staff members were having trouble overhearing what this one sister was saying. So thinking around, okay, if it's happening at a patient board, so they can go through talking it through, do they just need to improve the acoustics in that one area instead of maybe everywhere if there's cost issues, to try and resolve these issues? And again, other sensory aspects like lighting, heat, and the visual clutter. So these are some of the clips from the interviews. And again, they're talking here about struggling to hear the other staff members. So this has clear implications for the transfer, the patients, and misinformation and delay in proper patient care. So they're struggling with this background noise. In the children's ward, again, it was particularly noisy at times. Sometimes it'd be quiet. By the times you've got all these children, all their parents, crying, they're in pain. So it ends up that, you know, it's not an environment they want to be working in. And then the tannoy, it even went off every time within each of the interviews. So they would literally stop talking to me. They couldn't continue. They had to delay their patient care because you couldn't hear what was being said. In relation to light, they even refer to it being like a prison. It's causing eye strain, causing headaches. There's no windows. It's even like a casino, and this is their working environment, day in, day out, 12-hour shifts. Again, just feeling really hot. It's always really hot in here. And then even when they try and do their work, try and write up in places, there's not exactly many places they can do that, all the visual clutter in trying to find a space. So what did they do about this? Well, generally they just continue. They have to keep going regardless of these problems. There's not much they can do. That's how they feel. So they delay their patient care while they sort out things. Some of them will go speak to others, try and find a solution. So you can call these different coping mechanisms. Some of them are appraisal focused. So they just say, okay, it's a problem, it's there, I just have to accept it. But this could be also an issue of learned helplessness, so that they feel that they can't do anything about it anymore. They're already at that point where they don't think they have the ability to change the situation. But it's also could be problem focused. Some of them did go out to try and resolve the issues, but from what I could tell, not many of these problems were being resolved. And these coping mechanisms can have both a positive impact and a negative impact. So short term, they just deal with it. They're like, okay, this problem exists, it's noisy, just have to get on with it. But in the long term, it's still having an effect on them. It's still having those physiological impact. So it's not necessarily the best thing for them. And indeed, as you can see here, there was that effect. Even though they were trying to cope, they were still feeling hot, sweaty, they're still getting annoyed, frustrated. And overall, they just didn't feel that they were performing at the best that they could be. So there was that low job dissatisfaction. And in a knock-on effect, they're feeling tired, they can't perform as well, they're slow in concentrating, or slow thinking, and at times they're just having to leave the patient when they don't feel that they should be in that position. So if we relate these to some theories, so you might recognize this as a classic Yerkes-Dodson law, and it relates to if you've got a high level of arousal, you end up with impaired performance, so you can't do your job as well as you should be. And if we think about this in terms of an environmental load, if you've got all of these different sensory stimulation that all demanding your attention, so you've got different noises going on, high sound levels, it's hot, and you're trying to have to block out all of these things while you get on with the work that you're doing, then your performance is going to be impaired because your attention is being split amongst all these stimulation. At the other end, you've got the understimulation. And in some senses, you could say this is like the fact that there's no natural light in the room. So they didn't know whether it was day or night time, they couldn't tell what the weather was, and this messes with their biological rhythms as well. So again, you can end up with an impaired performance. So what you really want is that optimal level of sensory stimulation, something in between. And on top of this, there's the environmental stress perspective. So stresses within the environment or aspects of the environment are causing stress. And so that again enhances your level of arousal. So it's again pushing you to that point of an impaired performance. And what we really need to be at is in that optimal position. So you could say they need a sensory refuge. They've got all this bombardment of stimulation. They need a break. They need somewhere where they can go that's going to relieve their mind from having all of this competing stimuli. So I also think around this in terms of a restorative environment, somewhere they can recover and relax. So most research shows a place like that is somewhere that's going to help you restore. And actually, after all the Scottish things, this is a nice loch in Scotland where you hear the birds, you'll hear the water, you've got beautiful views. And all of these type of stimulus is of much kind of lower level, so it's involuntary, fascinating. It uses a different type of attention, so it rests your cells so that you can then go back to work feeling revived and being able to perform better. So that's what they need, but of course this is an emergency department, so they can't just step outside and have this. Instead they have this. This is their staff room. Not particularly a great sensory refuge. This is how they feel about it. It's uncomfortable, messy, not relaxing, too noisy. Again, there's still no window. 12-hour shift, this is where they go for 2 lots of 15 minutes and a half-hour break as well throughout that time. Not very inspiring, not very relaxing. And the cognitive test that we did actually showed that they came out of this staff room with the same level of attention as when they went in. So they weren't recovering at all. There were also old environmental cues. So this is, the staff room used to be a ward, a bed ward. And so this is the old rail that used to be around the bed. And apparently they kept this in because they thought, oh, well, maybe someone wants to do a bit of reading and have a quiet time, and we could just pull a curtain across and that would create it. Of course, that's not going to work, and so they got removed bits of it. You've also got noisy physical traces in there. So this is an oxygen point that was still present in the staff room. It's still leaking oxygen. They've put something in there, but it's still hissing away. So they're sat there trying to have food, and you've got this constant hiss in the background too. So just like we're talking about on the ward, which many of you may know causes as well stress and fatigue in itself, within the staff room, again, you've got the same issues, this tannoy that's going off. You've got people chatting. You can hear the equipment in the neighbouring room, so maybe you need to sort insulation out for certain rooms that are going to have noisy equipment. The dishwasher, again, too noisy. No one wants to put it on because no one wants to be in there when, again, you've got this extra noise. And then there were differences over the use of the TV in there. And then other sensory aspects as well, like it's even smelly in terms of people cooking the hot food, no window, don't get that ventilation. And this is how they described it again. There was this desire by some people, they accepted, there was a high level of people chatting, because it is a social environment. People do want to talk sometimes, let off steam, talk through their issues. So you're going to have that, but for other people, sometimes they just want to be alone and have that break. So it's about how can you manage that space, or maybe provide 2 spaces, so that you can get the balance for these individual differences. Again, some people want to have the TV, others don't. But for some, that prevented them from going into the room. However, it's all right for this consultant who had somewhere else to go, but for the nurses, that was their one place. That staff room was the only place they could go for their break. And there you go, the tannoy within a staff room. They knew it was a necessity, but again, it still prevented them from switching off, from having that break from their work, because they're still constantly on call. It's a constant reminder that they're not having that break. So where would they get to go then? Where else could they go? Well, like I said, for the consultants and the doctors, some of them had an office. So here you go, this is our office, you can just about see. And they talk about how quiet it is in there. It is their place, they can have some quiet time. The lovely big window, really lovely big window. So nice and relaxing, but also importantly, you can have a cup of tea, and I love this, so you can forget the noise of the world, so remember that when you're on your break. Was there anywhere else? Well, someone said, yep, they like to go outside. They do want that bit of natural environment. They want to go and get a breath of air outside. Just stand outside there, you know, in the ambulance depot. So again, could be bombardment of sensory stimulation, that rush of activity. Not, again, potentially the most relaxing of places. So to summarize, yes, emergency departments are stressful, just from the nature of the job. So why do we need to keep the environment also to add to that stress levels? There's of course variation between people. They differ in their stimulus screening levels, their ability to block out certain stimulus to attend to some and not to others. And that also varies depending on how they're coping with these and their opportunities to relax in different places. But it's important to remember it's not just sound, it is the other sensory elements too. There's this interaction between all the senses. So the noisy dishwasher meant there was never any clean cutlery, which meant it was always visually messy as well, so there's a knock-on effect. And sensory refuges are important, a place where they can recover, and that needs to be of an optimal stimulation level as well. So of course, there's behavioural aspects that you need to think around how the environment is being used, and therefore what's the best acoustic solutions that can be put into place for that. And they're just as necessary as working with the individuals. So thank you very much.